Well, it's summertime, and with summer come mosquitoes. They're our favorite, I know. Luckily, we don't have a huge mosquito problem here in Montana, but definitely around water sources and hiking in the woods, you will experience mosquito bites. It's important to know how to prevent mosquito bites, how to treat them, what to be worried about with mosquito bites, and also a little more about mosquito repellent. So there are two big ways to prevent them. The two biggest ways are to wear protective clothing, long-sleeved shirts, long pants, shoes with socks. I don't think you have to go as far as putting a net over your head, but if you are in a high mosquito area, that does work really well. The other way is to do repellents, and the most effective repellent available contains DEET. Now, DEET is a chemical repellent. You definitely do not want to use over 30% DEET in children of any age. Typically, it's from 10% to 30% is what is available. And when applying, you want to be very careful to just apply to the clothing and the skin that is exposed. There are some natural repellents that are available. The ones that have been proven to be effective are lemon eucalyptus oil and also citronella oil. Now these have the effectiveness of about 10% DEET, so on the lower range, but they still are effective. Keep in mind that these you will have to reapply every 1 to 2 hours. They don't last quite as long as the DEET repellents. I get a lot of questions about how do I prevent mosquito bites in my infant. Now we really want to minimize the chemical exposure of DEET to infants because their skin is so sensitive and does absorb ingredients very well. The best way to do this is definitely do not apply DEET, any sort of bug repellent with DEET to any children 2 months or younger, and you want to be very cautious in any children that are 6 months or younger. One really good method is to take the clothing that they're going to be wearing, to spray it with DEET before they put it on them, and then use a natural repellent directly on the skin, one of the natural oils. They do offer some really great options with mosquito nets that you can put over the stroller. You can also put over a backpack carrier, and also the play yards that you have out in the yard. Oftentimes the holes are small enough and you can get a net that covers up the top of the play yard if you are in a high mosquito area. Another important thing to remember is typically mosquito bites, not everyone reacts to them, but once in a while children will have a large area of redness and swelling. That is okay. We would expect that to go away in 2 to 3 days. Some good ways to treat mosquito bites at home include applying topical hydrocortisone cream. Another good option is to apply calmoseptine, and your child can also take oral Zyrtec. During the day, less drowsy, and they can take Benadryl at night. Now, you don't need to do any of these treatments, but if your child is having some significant itching or has multiple bites, then I would recommend them just to help with the itching and the symptoms. Reasons to call the clinic or come in for us to see your child is if that bite site doesn't improve, if it becomes very tender, hot, red, and your child has a fever, then we will want to check it and make sure that it is not infected. All right, have fun out there.